Hi, my name is Olivia Parker, and I will be going through the usability assessment of medical device reimbursement. So to start, usability assessment. So technological tools and advancements are associated with the effectiveness with patients, physicians, and healthcare professionals are provided with based on the efficiency of an EHR provides. So kind of just going through this, I really wanted to add this as my main slide just to kind of get this started of the advancements within EHR platforms, patient portals, since technology is continuing to advance each and every day, as reflected within all different medical fields. Even with mine currently in a pharmacy, we use EMARs, so still same thing, but a little different than EHR. We really can't collaborate on those EHRs. We really can only see what they see and what we see. And we really only use it to view medical record profiles, current medication list times, previous visits that the patient may have been seen on, discharge transfer dates, things like that, that the EMARs really speak to us, which are different than EHRs, especially within hospitals, clinics. So I really wanted to highlight on this just due to the technology advancements and tools that are present within EHRs, but there's always room for advancements and also challenges that one may face. So continuing to evaluate that is very important. So purpose of the study. So the purpose of the study included 3 users within the platform EHR Go by carrying out an administrative task. So the 3 users. So the first one is the patient. So the administrative tasks focus on identifying patient user A within the EHR being ordered a medical device, including hearing aids, by a healthcare customer service reporter, user 2, which is user B. Also by checking for healthcare coverage, which is submitted through the medical billing specialist, user C. So I incorporated user A, B, and C within this to keep it anonymous. Also, this just allows you to kind of keep track which user is user A, B, and C, which you'll see going forward. I created also a table that just kind of specifies that within my assessment paper and also this slide, just so it doesn't get confusing along the way, since both of these two of the users use more of a complex terminology for their role. So this just simplifies them easier. So participants. The participants within usability assessment include the patient, healthcare customer service reporter, and medical billing specialist. Individuals were recorded in the study based on user A, B, and C. And these individuals were evaluated based on criteria being investigated within the EHR. So I chose these participants since I think it speaks volumes to, just as the new year kind of was just a few months ago, which is kind of weird since it's now March, but January seems like it was just last month. With that, individuals did experience higher volumes of medications not being covered, inactive insurance because they didn't hit the deadline right away when January 1 came to reactivate their insurance. So I just thought it was really important to highlight on this, and that's why I chose these participants, with individuals being user A, B, and C, just so we can kind of include the different things that go on within seeking reimbursement for a medical device, and also ensuring that these healthcare customer service reporter and billing specialists really have major involvement in seeking insurance coverage and also billing these claims. So this was kind of the main reason behind using these designated participants within the study. And this is, as I mentioned beforehand, this is just kind of an image that I kind of used just to kind of format it so it's more visible to the eye. So first thing being patient, the user A, identifying individuals being seen for hearing impairment. Second user being the healthcare customer service reporter, user B, which is the individual navigating the EHR platform regarding current healthcare coverage, patient portal, and customer inquiries. And then user 3, which is the medical billing specialist, user C, which is the medical billing specialist submitting the medical device to review if cost reimbursement or coverage is available. So this platform kind of just makes it a little bit easier to see so it doesn't get confusing along the way. Because as we go through assessments and studies, sometimes you can kind of get caught up in all the information and not understand, well, which user is doing this, which user is that, and what is their main role. So I kind of simplified it in the term of just using a user and a role so you understand what the crucial role is within each of these users. Now for the methods. So I used 2 different methods within this assessment study. First one is a user-based usability testing. So using this, it just allowed for testing to be evaluated due to the ability to navigate to the patient profile, insurance history, and medical history of ordering of devices. So this just kind of allowed me to see the user-based usability and how, as individuals, patients, healthcare professionals, physicians, all of the above category within the healthcare field, how they use user-based usability just to see how they're doing and how their user-based testing is going forward within a study. And also with this, I use heuristics evaluation. So this evaluation contributes to the interface of the design system relating to the process of the user's identity throughout the assessment. So this kind of goes into the life cycle, which is very important within the heuristic evaluation due to Nielsen's steps in his heuristic evaluation. So I wanted to implement this since I think it's highly important to users within an assessment and study, since the steps and procedures that he implemented within his design really speaks volumes on how usability is incorporated and how to evaluate it over a short or long period of time. And this is one of them that I found based on user-based quality testing. So this uses a systematic review process, which the image kind of speaks to. So the planning, conducting, reporting, the data sources, study selection, and results that are pulled from each of the planning, conducting, and reporting categories. I kind of use this throughout my assessment just to kind of look at the different areas. And I just thought you can always use graphics. Usually using graphics, less words allows you to kind of take things in better. And as someone as me, I like seeing graphics because it makes me think, oh, okay, very simplistic graphic, which seems, oh, planning, conducting, reporting, which pulls all of the data sources, the study selection, which is shown within the assessment paper, which then allows to see the results too. So this is just one image that I thought really kind of advise the user-based usability testing and also uses the systematic review process as well. And then for another image that I gathered, which is the heuristic design as well. So it uses these different design modules, the recommendations within each of them, which was shown in one of my articles that I used throughout my paper as well for the heuristic evaluation of Nielsen. This image just kind of simplifies it into the different recommendations of the design categories. So I just thought it was important to add this in since everyone's assessment can be different. After reading multiple different studies within this unit, the use of design is reflected completely different, using different assessment models, usability testing, and also terminology management, which is shown within almost every study, even if it's not specifically advised. It's just reflected differently. And now for results and recommendations. So the results indicated that the patient does not have active insurance, leading to further examination to be concluded by the users to determine if the patient is willing to pay out of pocket for the hearing aids, since the code set provided within the HCPCS level 2 cannot be applied. So taking in the code sets that you would usually submit for a medical device would be the HCPCS level 2 code set. But in this case, since the patient does not have active insurance, we unfortunately cannot submit a code set. And the results and recommendations indicated by the users contribute to areas of information resources that are present within the EHR. So different recommendations and results reflected in it could be minimizing the categories. There are many categories reflected. Also creating an alert button for those that do not have active insurance. Since even with my field currently, trying to find insurance can be relatively time consuming and difficult to find because sometimes an individual may not have insurance, yet it may be submitted somewhere else. So finding the insurance and also figuring out where it may be, since there's so many different insurance platforms regarding Medicaid, Medicare, private out-of-pocket insurance, public. So really creating those alerts within the EHR can be very beneficial as well. Also, improving the layout of the EHR contributes to functions that both user B and user C are able to view to lessen time spent determining if the patient has current healthcare coverage. So as I just stated, creating those alerts and also improving the layout. Since within an EHR, you can view many different things and it might also feel, whoa, too much information for me to take in all at once when I'm just wanting to find healthcare coverage for an individual. And I will speak just for myself, even with EMR platforms, that can be hard as well. Since there might be so many different tabs to locate something, you might find, oh, well, a patient may have had active insurance at this specific time. Well, now they don't. Well, why is that? So creating those alerts for all healthcare professionals to view, even if you're logging in, looking at a patient profile and it alerting, individual does not have active insurance, may be working on it, or do not have the necessary resources to find insurance because they may not have a POA on file. So just improving the overall layout, creating those alert buttons for the user B and user C to see if user A really does have insurance, if it may be somewhere, or maybe their insurance just may have been terminated due to submitting for the medical device of the hearing aids would be very beneficial. So for conclusions and priorities. So based on the results provided from the study regarding the user-based usability testing and heuristic evaluation provided the users with the necessary knowledge to further receive reimbursement. As user B and user C navigated through the EHR, clinical decision support had the potential to support identifying patients and healthcare coverage. With this, the clinical decision support really helped user B and C since they were able to see that there is no healthcare coverage currently for the patient. So that led into advising the patient of reimbursement costs. Since secondly, there has to be some sort of parameters right there with the reimbursement since you have to submit for something even if they don't have coverage. So that means almost just paying out of pocket for those medical device, in this case, the hearing aids. Also, enhancing the layout and the EHR provides support to all users identified within the study, limits time spent on navigating to each EHR as well. So with this, it just kind of allows all users, even if the patient is wanting to access their portal as well, lessening the different subcategories that are visible within the EHR can provide support to the patient as well, debating on the current age of the resident as well, if they have access to a computer, or if one of their significant others, or even their family, or an individual that is their POA also has the access to, and instead of going to each subcategory to figure out which is which, just simplifying the layout in the sense that it also helps the individual that is the main person of this, which is the patient. So making it easier for them as well. Post-evaluation. So evaluating the study provided information into the advancements needed within the EHR and patient portals to provide healthcare professionals with necessary resources to dictate healthcare coverage and advise the patient of reimbursement costs. So with that, this assessment study really just evaluated based on the three anonymous users that I use that were set up based of the patient, the healthcare customer service reporter, and then the medical billing specialist, which were anonymous. However, they did each have a different identity within this study, really allowed me to see as an outsider after looking at this assessment that, wow, that sometimes it can be hard to get reimbursement costs on a medical device, especially within a world today where technology is ever flowing in a different way. And we may get behind on reimbursement costs too and submitting for insurance. So just being mindful of these parameters that are set up in EHRs to also make it easier for healthcare professionals as well. Since if we have a platform that allows us to either find healthcare coverage or even dictate if they don't even have healthcare coverage, because we can always send those papers for them to sign up, but are they really going to sign up? And I think that is also a big thing to advise as well. So that's why I wanted to include this within my post evaluation, is just to be mindful that there's so many different scenarios. Yet this is one scenario that just allowed me to see that someone, if they, an individual that is being prescribed a medical device, a medication, that means that they do need it. So making sure that we can give them what they need, but also on our end, making sure that all of our policies and guidelines meet the reimbursement costs, and submitting for the insurance is important as well. And then these are my references that I use within my assessment as well. But overall, just taking it in, this was a really interesting way to put everything together, especially within putting it into an EHR as well and seeing the different things where we can create them, but also merge them into a study as well. So thank you for watching.